becomes a genetic counselor, we go through a master's program for genetic counseling, where we are trained both in medical genetics and then also in counseling.
For us here at the Cancer Center, we work directly with people who have either a personal or family history of cancer. Typically what a genetic counseling session might look like would be starting with taking a patient's personal medical history and then moving to look at the family history as well.
It's very important that we ask questions about both mom and dad's side of the family, as both sides are important.
Taking those two in combination often helps us assess what might be happening in the family and if hereditary cancer is a possibility.
Most cancer happens by chance, and so most people don't need to see a genetic counselor. But if a physician or other healthcare provider notices certain features or clues in the personal or family history, then they may be more concerned that someone could have a hereditary predisposition to cancer. When we think about hereditary breast cancer, there are two genes that are the most common causes of an increased risk for breast cancer. Those two genes are called BRCA1 and BRCA2. While we know that in the general population there's about a 1 in 400 chance to have a BRCA1 or BRCA2 gene change or mutation, we know that in certain ancestries this chance can be higher.
Genetic counseling is very important and very useful for a patient. With BRCA, there's an increased risk for breast and ovarian cancer. Ovarian cancer, it's a very rare cancer. The population risk is about 1.4%. However, with this mutation, you bump up into a risk of 40 to 45% of developing ovarian cancer. Identifying these women who carry this mutation that predisposes them to a very high percentage of developing cancer is extremely important. And our geneticist can help identify those women and test them appropriately.
There are certain clues or features that we look for in a family that might help give us a better idea if hereditary cancer could be a possibility. So we look for a few different things. One thing we look to see is if there's 2 or more people in the family with the same types of cancers or cancers that can come together. For example, if we see multiple people with breast cancer or perhaps a family where there's both breast and ovarian cancer. We also look to see if there's young ages of diagnosis, so for certain cancers being diagnosed under the age of 50 can act as a clue for hereditary cancer just because they're less common under the age of 50. We also look to see if there's multiple generations affected, so when a grandparent, a parent, a child all are diagnosed with the same types of cancers, that definitely acts as a clue for hereditary cancers. We can also look to see if there are any rare cancers. So something like prostate cancer in men, breast cancer in women, unfortunately are just very common. But when we see an ovarian cancer in a woman, that is more rare, and that makes us think about the possibility of hereditary cancer. And a last clue that we look to is ancestry. So there are certain ancestries that we think about for certain hereditary cancer conditions, with an example being the Ashkenazi Jewish population or Eastern European Jewish population. When we know that someone is Ashkenazi Jewish and has breast cancer, that makes us a little bit more suspicious for hereditary breast and ovarian cancer.
We take your personal history and your family history and we try and make an assessment. And we look for certain clues to see if there's an increased chance that there might be an inherited cancer condition, and that could be causing an increased chance for the cancers that we're seeing in the family. And then from there, we talk about kind of what we're seeing in the family. We talk about, maybe if genetic testing might be warranted, if that's something that should be considered. We talk about what that could mean for you, what that could mean for your family. We also talk about, maybe you're not the right person to consider genetic testing. Maybe there's someone else in the family who's going to be more informative, and their genetic testing results might be more helpful to the whole family. We also talk about if this is something that you want to do, if this is information that you want, what type of information you want, what are your motivations for considering this, what maybe is making you hesitate. And we try to work through all of that so we can come to the best decision for you at this time.
From there, if genetic testing is something that makes sense for the patient to do, we would send them off to do either a blood sample or a saliva sample typically. And genetic testing results take a little time to come back, usually 2 to 4 weeks at this point in time. And then we always like to meet with our patients in person to go through the results, explain what they mean for both them and their family members.
Sometimes genetic testing isn't indicated or an individual isn't interested in genetic testing, and so at that point we will talk about what would be recommended based on the family history itself or the personal history for that patient, and specialize management or screening based on that. For breast cancer, for example, we might talk about doing increased breast screening, like not only annual mammogram, but possibly also adding additional screening like annual breast MRI.
If I have identified a patient as being high risk, or their primary doctor or another physician has identified them being at high risk for developing cancer, it's important that they do go and see the geneticist and have this counseling appointment. However, with genetic testing, we are looking at inherited reasons for cancer. So the information that someone gains by being tested or meeting with a geneticist not only can benefit them, but can benefit their children, their grandchildren, their nieces, their nephews, their great-grandchildren.
One of the reasons that we like people to come to genetic counseling is so that we can really walk them through the process. Sometimes thinking about cancer in the family, or if you have a personal history of cancer and thinking about what that might mean for the rest of your family, that can be really scary. As a cancer genetic counselor, we're really trained to not only assess your family history and give you some accurate risk estimates of what your chance might be to develop these types of cancer, but also to really help you through the process. We're there for you every step of the way.
Genetic counseling really helped facilitate us getting tested in the first place. And by getting tested, I found out that I was a BRCA carrier. And by doing so, I was able to take proactive steps and have a oophorectomy, and found a lump and do a lumpectomy. And it, in essence, could have saved my life, and probably did save my life.